Hi guys, my name is Sanjay Gupta. I'm a consultant cardiologist, and today I wanted to do a video on about health. And this is a particularly apt topic because of the new year. And for a lot of people who make New Year's resolutions, health is going to be up there uh, amongst some of the popular New Year's resolutions. And I thought I'd just talk about health for once, because although the word health is branded around, the truth is, what is construed as health management is not health management. And I thought I'd give you some insider, some knowledge that I have come across as an insider about health. So the first thing to say is that I've now been a consultant cardiologist for 5 years, and I've been doing cardiology for 20 years. And one thing I've realized is that people are getting sicker. Number two, the burden of disease is going up. Number three, no matter what we do, we rarely get anyone better. And even though we may temporarily make them feel like they're better, generally, if you follow patients up, they come back, and then they come back, and they come back again. And I became a little bit disillusioned by this, because I thought, well, you do all this work and all this technology, why aren't people getting better? And it became very apparent to me that actually the healthcare industry is not really about healthcare, okay? The healthcare industry is about disease. Okay, they're interested in disease, not health. The healthcare industry can be likened to the cosmetic industry. You develop a disease, you develop a problem, you come to your doctor or your hospital, and we apply a layer of makeup, and we let you go, and we wait for your disease to show through the layer of makeup, and then you come back and we apply a more expensive layer of makeup. But we're not actually sorting you out. We're not actually making you better. We're masking your symptoms. And most people are interested in your disease. Pharmaceutical companies, they're not interested in your health. It doesn't pay anyone for you to be healthy other than yourself and your loved ones. It does, however, pay a lot of people if you develop a disease. And so rather than being considered health providers, we should be considered as disease modifiers or disease managers. And it's really important to realize that, because the minute you understand that actually no one is really interested in your health, people wait for you to develop your disease and then get interested in it. The quicker you realize that, the quicker you understand that the only person who the only person who should care, is you. As a person who's worried, the only person who's interested in your health is you. Okay, and therefore you have to take responsibility for your health at a stage before you develop a disease. The problem these days is that the majority of disease, the majority of times we develop diseases, it's too late. Okay, because the majority of diseases that people develop in the Western world are chronic diseases. So they come about because of several years of wear and tear or damage. And by the time the disease manifests itself, it's too late. You can't go back. And therefore, after that, it's just a case of damage limitation and masking symptoms. And therefore, the question then arises, well, how can you try and modify your health at an early stage so that you never develop a disease? And the answer is this, that a lot of times diseases are categorized or defined by numbers. People will say, oh, my blood pressure was normal. My blood pressure is 140, 120 over 80, so I don't have high blood pressure. That's true in the sense that you don't meet the definition for sort of what they call high blood pressure, but that doesn't necessarily mean that you don't have high blood pressure. High blood pressure doesn't develop overnight. Okay, you can get diagnosed overnight. You can have a blood pressure of 130/80 2 days ago, and then come and have 2 readings of blood pressure over 150/90, and your GP will say, well, you have high blood pressure. But the truth is that that blood pressure has been gradually creeping up. So you've been developing this over a number of years. And with regards to definitions, those change. There are a bunch of professionals sitting in a room who don't know you, who turn around next year and say, oh, actually, high blood pressure is not 140/90. We're going to call it 130/80. But where does that leave you? You've been living with a blood pressure of 130/80 for the last 10 years, and suddenly someone says, oh, no, you have actually had what we consider high blood pressure over the last 10 years. So I think it's really important to bear that in mind. And also, same with diabetes. Someone does your blood sugar, they say, oh, you don't have diabetes. You can't just say, oh, just because you've crossed a number, that's when you have diabetes. You have to look at the changes that occur in your body over a number of years. Sure, you may one night develop a reading which is above the commonly accepted definition of diabetes, but that doesn't mean that for the last 5 years prior to that, you were not diabetic. You were probably developing diabetes. It's just that we need to be, as research progresses, we will find that these numbers get less and less. And therefore, the question is, what can you do about things now? Now you're faced with a new year. How do you look after your health? And basically, health boils down to 4 things, okay? Number 1, your age. The older you get, the more likely you are to get ill. Your luck, you can just be very unlucky. Your genetics undoubtedly play a part. But these 3 things, age, genetics, luck, you can't really do anything about. 4. Number 4 is lifestyle, okay? So lifestyle is crucial, because if you do things about your lifestyle now, you can feel confident that you've done everything you can to try and stay healthy. So if you are overweight, work now to try and lose that weight. If you're sedentary, work now to try and get more mobile. If you don't sleep well, work now. Get your counseling now so that you can try and sleep better. Because by the time someone tells you that you have diabetes, or someone tells you you have high blood pressure, you will already have had, some, the changes associated with high blood pressure. You will already have suffered the changes or the consequences of high blood pressure for the 5 or 10 years preceding someone telling you, oh, you have high blood pressure. You don't have high blood pressure the day you're told you have high blood pressure. You start developing high blood pressure much earlier. Similarly with diabetes. So don't wait for symptoms to develop. Don't wait to be given the diagnosis of a disease. Do something about things now. And a lot of people will have asked me, well, what can we do now? And what I'll try and do is do a bunch of videos on lifestyle, because a lot of people assume lifestyle is just about getting exercise and eating healthy, and those are really important issues, but there are other components to lifestyle that are really important. So I'll do a series of videos on what you could do this year to try and improve your lifestyle. So again, let's think health, let's not think disease, because by the time you develop a disease, it's too late to go back to health. So I hope this was helpful. I wish you all the best. Here are my details. You can contact me on yourcardiology.co.uk. I have a Twitter account and I have a Facebook account, and I'd really be grateful if you could consider sharing this with people, just so that that message of good health comes across, rather than assuming that, oh, well, if there's a problem, we'll go and the healthcare sector will help us out. They won't. They'll mask your symptoms, but they won't really get you back to health. All right. So I wish you all the best, and I'll speak to you soon. Take care.